At the end of the day, also, though, we want transportation to kind of be the thing people forget. When you're in the midst of a care journey, there's so much you're thinking about, you and your family you're going through. And we want transportation to be the sort of the furthest thing from people's minds. It just sort of works, right? So that's what we strive for.
Ride Health helps manage transportation and communication for populations who may have difficulty getting to and from the hospital for a variety of possible reasons. You all have been dubbed the Uber for hospitals with this integrated transportation network and automated communication platform. And then enter COVID. And you all were able to completely pivot and kind of refocus those efforts on the pandemic and everything that came along with it. But before we jump into that, for those who may not be familiar with Ride Health, I'd love if you could just give an overview of the platform and how it works.
As you said, we address the needs of hospitals as well as health plans across Medicare and Medicaid aligned populations, and even some work with life sciences, which became even more meaningful over the past year. In terms of how the product addresses the needs of those different segments and the patients and members they serve, we're able to ingest trip requests from different sources, whether it's a care manager at a hospital or health plan using our coordinator portal to enter a trip request. It could be a member using our passenger portal to set up the ride on their own, or it could be a member calling in to our managed contact center to request a ride. And so regardless of the way that a trip is entered, our system takes a look at all the different attributes, from where it's taking place to the level of service that's required, from curb to door to wheelchair to stretcher van or ambulance, as well as the hour of the day and time of the week, to then determine which transportation provider in our network is most appropriate for that ride. And so we have a system for both filtering to find those appropriate providers, and then prioritizing among them based not only on cost, but also on a weighted quality metric that takes into account their historic on-time performance and other performance measures to decide who we want to prefer. And that creates kind of a dynamic and merit-based marketplace over time. And when we send a trip offer, that trip is then linked with the trip entity in that provider's dispatch system. So then we get the real-time status updates. And that's really at the center of our value prop, is those real-time status updates, because that allows us to send communication to the passenger through SMS or voice calls, depending on their capability, as well as to the coordinator who may be monitoring the ride in the portal. And then also to our own ride success team, who kind of act as the eyes in the sky, making sure that all of the trips in flight are going well, and intervening if there is some type of issue that we detect with a ride. And so that's kind of how the product itself works. And there's a lot more in terms of meeting the unique needs of health plans with different types of benefit and allotment structures, or meeting the intricate needs of life sciences organizations and how they design their trials with many different sites over different areas and different funding sources and cost centers there. So we have a very flexible product to meet the needs of diverse organizations. But at the end of the day, it's a common technology infrastructure for getting patients from point A to point B. Yeah, so one of the first things we realized was that we sit at the intersection of a lot of impacted stakeholders in this situation, from the immune compromised passengers who would be getting into cars, to the drivers who are kind of nervous about who might be getting into their cars, to the facilities that were overwhelmed and stressed out in those early days, and the health plans trying to figure out how to meet the needs of members who are now limited in their ability to go places, right? So we knew we had a role and a responsibility to be helpful, like many companies that operate within healthcare and mobility. And the three things that we focused on, number one was ensuring that life-sustaining treatment access would still continue. So people going to dialysis or going to chemotherapy, radiation therapy. Number two was to work with health plans who have homebound, generally seniors, Medicare Advantage plans who needed meals delivered to them. And so immediately we started working with plans on that. We had never really done food delivery before, but we repurposed our network of transportation providers who were seeing reduced volume themselves for a little while there to deliver food to people's homes instead. And then the third thing that we focused on that became most meaningful for us as an organization was the notion of COVID positive transportation. So we realized, pretty early on, this was going to be with us for a while. It still is, obviously. And there would be a need to transport people when they were either COVID positive or suspected or confirmed exposed, those types of situations, to move them between facilities or to get them from the hospital home if they're a more mild case, to make room for someone who's in a more acute situation. And so we started working with hospital clients and with our transportation providers to figure out which of them could accommodate COVID positive rides. And we built in tools to our product, a COVID screener, so that we would match to a COVID level of service the way we would to a wheelchair accessible level of service. And so that ended up being pretty powerful, because it turns out the nationwide COVID vaccine and therapeutic trials needed a partner to be able to assure COVID positive transportation for study participants, whether they were in the vaccine trials and needed to come in for a sick visit because they thought they had symptoms of COVID and needed COVID positive transport there, or on the monoclonal antibody side with therapeutics. By definition, someone participating in those trials has been diagnosed with COVID within the last 6 days and needs COVID positive transportation. So that became sort of a nationwide opportunity for us. And we're currently working with a couple hundred different clinical trial sites that are part of the Moderna, AstraZeneca, Janssen, Novavax, Sanofi, Regeneron, and Eli Lilly vaccine and antibody trials. And that work will be continuing through the rest of this year. So it's really been an unpredictable year in many ways, but we're grateful for the opportunity to be involved in these different ways and be helpful where we can. We were designed without the assumption that the passenger would live in an urban area or have a smartphone or speak English as a first language or be able to navigate and ambulate independently without support. So from the beginning, we've had an emphasis on inclusion and accessibility for different types of complex and vulnerable populations. And I think that approach extends to the way our contact center agents and other team members work with passengers and coordinators and drivers day to day, so that we're creating that supportive experience. And so we hear the feedback every day throughout the day. We get we send surveys after each ride asking people to rate 1 to 5, and sometimes people just share a number, and that's great. But other times we get these qualitative comments from people where they talk about what a weight has been lifted from their shoulders because they know that they have someone, an entity and a partner they can count on to get to and from care. So we're really grateful for those types of comments from people. And at the end of the day also, though, we want transportation to kind of be the thing people forget. When you're in the midst of a care journey, there's so much you're thinking about, you and your family you're going through. And we want transportation to be the sort of the furthest thing from people's minds. It just sort of works, right? So that's what we strive for. Yeah, our plan and focus is really on continuing to invest in our product development to continue to meet the nuances of different types of verticals within the market, as well as to continue building out our network. At the end of the day, the network is the product in many ways, beyond the nice front end and the nice connective systems among everything. And so I think those are our key focus areas as we look to support the scale that we're anticipating this year and in future years.